many times have you sat in a dental chair, written out a big check, walked out feeling hopeful, and then 18 months later, something cracked, came loose, or got infected again? If that sounds familiar, I've got news for you. It's not because you've had bad teeth, it's not because you're unlucky, it's because something underneath has become ignored. In the next few minutes, I'm going to show you the real reasons your dental work keeps failing, what the cycle actually looks like, and what you can do to break out of it. By the end, you'll understand why nothing has held up so far and what a proper long-term solution actually looks like. You've done everything right. You've shown up for the crown, the bridge, the root canal. You've paid for it. You've looked after it. And it broke anyway. Now you're wondering, is it me? Do I just have weak teeth? Or am I unlucky? None of those are the real answer. I'm Dr. Naresh Hirani. I've been a dentist for nearly 25 years, and I take care of patients whose work has repeatedly failed. I see this exact pattern every single week. In this video, I'm going to break down 5 reasons your dental work keeps failing, and more importantly, what to actually do about it. Stay with me, because the last one is the one that changes everything. Point 1. The foundation was already failing when the work was done. Every crown, every bridge, every filling, every implant has to sit on something. That something is your tooth, your gums, and the bone beneath. If any of those are unhealthy when the work is placed, the work is already on borrowed time. It doesn't matter how good the dentist is or how expensive the materials are. You're building on shaky ground. Here's what nobody tells you. The success of your dental work is decided before the drill even touches your tooth. I see patients all the time with multiple crowns placed on teeth with active gum disease. Within a few years, the gums recede, the bone shrinks, and that perfect crown starts failing. The work wasn't the problem, the foundation was. Think of it like this. It's like building a beautiful extension on top of failing foundations. The extension might be flawless, but if what's underneath isn't solid, the whole thing eventually fails. If your dentist never measured your gum health, never showed you the bone levels, or never explained the foundation first, you've just found your first answer. But foundation problems are only half the story. Point 2. Your bite is wrecking your teeth, and you don't even know it. Your teeth are designed to come together in a really specific way. When that bite is even slightly off, certain teeth take far more pressure than they're built to handle. Over time, that pressure cracks crowns, fractures roots, loosens bridges, and breaks fillings. It's constant, it's invisible, and it never stops. You can replace the work again and again, but if the bite is wrong, it will fail again. Here's the truth. Your dental work isn't breaking because of the materials are weak. It's breaking because something's hammering it day and night. I've seen patients replace the same crown 3, maybe 4 times. Every time it's blamed on bad luck or hard food. No one actually checked the bite. Once we fixed that, the next crown lasted years. Same tooth, same materials, completely different outcome. Think of it like a car with poor wheel alignment. You can buy the best tire in the world, but the alignment is off. It will wear out fast. Your bite is that alignment. If you grind your teeth, wake up with jaw tension, see chipped edges, or keep fixing the same tooth, your bite is almost certainly part of the problem. And here's the frustrating part. If you're starting to realize why nothing has worked, this is exactly the kind of content I share every week. Hit subscribe so you don't keep making the same expensive mistake twice. Point 3. If you're getting tooth-by-tooth treatment when you needed a full plan, most dentistry is reactive. Something breaks, you fix it. Something else goes wrong, you fix that. And the cycle continues. But if you've got multiple failing teeth, the answer is almost never another patch. The answer is a comprehensive plan. A plan that looks at every tooth, your bite, your gums, and your bone, all at once. Here's the truth. Reactive dentistry is the most expensive kind of dentistry there is. And most patients are stuck in it without realizing. Patients I see after years of failed work all say the same thing. I've seen multiple dentists. I've had different opinions, but no one ever showed me the full picture. Once they finally see it, everything clicks. Ask yourself, have you had multiple treatments over the last few years? Has anyone shown you a full long-term plan? Does it feel like you're constantly reacting instead of preventing? If yes, that's why nothing has lasted. But there's one more reason, and that one reason changes how you think about your teeth completely. Point 4. Some teeth should not be saved, and trying to save them is making things worse. There's an old belief that every tooth should be saved at all costs. I used to believe that too. I don't anymore. After 25 years, I can tell you this. Some teeth are beyond saving, and continuing to patch them doesn't delay the inevitable. It makes the next solution more complex, more invasive, and sadly, more expensive. Every failed root canal weakens the bone. Every new crown removes more tooth. At some point, the smartest move is to stop and reset. Let me say this clearly. Holding on to a failing tooth is not loyalty to your mouth. It's a tax on your future. I've seen multiple patients spend 5 figures trying to save teeth that should have been removed years earlier. By the time they arrive, the bone has shrunk and the solution is twice as complex. If you're repeatedly treating the same tooth, get a second opinion. Ask this question directly. Is this tooth worth saving long term, or am I throwing good money after bad? You deserve a straight answer. And that brings me to the most important point. Point 5. Nobody's ever planned your treatment around what you actually want for the next 20 years. Every problem we've discussed comes back to this. If there's no long-term vision, the work will always be temporary. Your teeth aren't for the next year, they're for the next decade and beyond. A proper plan starts here. What does the patient need their mouth to do for the next 20 years? And then works backwards. That's the difference between constant repairs and finally having it sorted. Think of it like this: hiring a builder to fix one room while the rest of the house is falling apart. They fix one thing, leave, and then something else breaks. What you actually need is an architect. Someone who looks at the whole house and designs it to work together. Here's what I'd like you to do tonight. Take 10 minutes of your time, write down every dental treatment you've had in the last 10 years and roughly what it cost. Then write, what do you actually want your teeth to do in 10 years? Eat anything, smile confidently, stop worrying. Now compare the two. If they don't match, you don't need another quick fix. You need a comprehensive plan. Bring that list to your next consultation. It will completely change the conversation. Your dental work isn't failing because of you. It's failing because no one has stopped the cycle and planned it properly. The good news, that cycle can be broken. And once it is, you stop worrying about which tooth is going to go next. If you're thinking, what if I've been told dentures are my only option? Watch the next video. I break down why dentures are almost never the only option and what most dentists don't tell you about the alternatives. It's on screen right now. Click it and I'll see you there.